Hi, and welcome to RTP Business Live. I'm Bob Collier, your host, and today we have a special guest. Our guest is Nancy Ruffner. She is president, and she's also a professional advocate, and her company is NAVIGATE NC. Nancy, welcome.
Thank you, Bob.
Well, let's jump right into it. What are professional advocates, and what do they do?
Well, professional advocacy is an emerging profession. We help folks to navigate a complex healthcare system and meet the challenges.
That's an understatement.
Yes, it is. We help them navigate a complex healthcare system and meet the challenges that come with aging or chronic disease.
In this day and age, with the baby boomers heading in that direction, I guess that more and more need for that. Not to mention, as you said, the complexity of the healthcare system as it stands. It's getting more confusing by the day, it seems. Well, tell us about NAVIGATE NC.
Well, I founded NAVIGATE NC in 2013 in response to a growing population,
Yes.
in response to the advance of the baby boomers who were seeking help for their aging parents. 10,000 people a day are turning 65. There's your water cooler talk.
Ouch.
And a lot of them are coming to North Carolina.
They really are, yeah.
And they need help because we don't live in the same community as our parents often. I'm frequently contacted by folks, adult children who live out of state, but their parents are here.
I'm experiencing that with my folks and their friends. Their friends are getting to an age where they're leaving the retirement community where they were to get back closer to their children a lot of times.
Yes,
so that's
indeed.
I see that and talk with them almost daily about some of the issues that they're experiencing right now. Well, what makes you different than, say, a geriatric care manager or others who perform like services?
Well, with respect to geriatric care management, the differentiator there is geriatric. I'm not limited to serving just the geriatric population. We serve all ages and a myriad of needs. I'm different from, say, a hospital patient advocate or an insurance care manager, both of whom do really, really good work, important work. But we're different in that we go beyond the door of the hospital or beyond the auspices of the insurance company. We work in direct service to the client and their family and not the system. And for that reason, we're private pay. It's a follow the money kind of situation. To find your allegiance, you need to, we find that we need to be in direct service to the client.
So once my particular health care, maybe a crisis has occurred and that healthcare need has passed, some of these folks might go away.
Right. We like to say that we go beyond the door. We go with you wherever you are, from home to hospital to rehab and back home, wherever home may be.
Because even though the crisis has passed, the getting back to the everyday living might be a huge challenge for folks.
Exactly. Or you may have a new diagnosis to adjust to. You may need some services in your home or services brought into the community where you're living.
And that's so important. Folks wanting to maybe stay in their home or stay where they have been as long as they can reasonably. And I guess you help them with finding the resources to do that sometimes?
Yes, we do. I like to say that I'm an interprofessional in that I work with a number of folks. We may have contact with housing professionals, doctors that will see folks in their home or in their facility. You may have short-term needs for physical therapy. You may need home modification. You may be deciding to move into a community, but you need a realtor to sell the old home place.
Sure.
Which brings in the senior movers, the professional organizers, the landscapers, and the real estate people.
Can be daunting for somebody to take that on when they don't know the folks in that particular market and don't know even sometimes, I guess, where to begin. Well, I guess we might want to tackle this from a couple of different perspectives, but when should folks call NAVIGATE NC?
Well, you kind of just touched on one, and that's when they may not be familiar with the lay of the land. Perhaps the loved one is here, but the relatives live elsewhere that have concerns, or the folks that are that hold power of attorney live elsewhere. I'm local eyes and ears. I'm boots on the ground here for folks. They will generally call us from, well, generally in crisis, but maybe we need a benchmark. Where exactly are we right now? Or we're going to develop a plan. We need a starting point. We need that benchmark. Or we're stuck, or we're stymied, or we're, as we like to say at Navigate NC, we're stuck in the kaleidoscope, because just about the time that you think that you've got your vision clearly in focus,
Right.
the kaleidoscope will change, and you need to be flexible and nimble in your planning, and we're certainly that with our clients.
Well, Nancy, you mentioned a lot of folks, the time that they get started with you is in that crisis point, when things are almost out of hand and they need some action right away. But is that necessarily the time to contact you? Can I get in the game a little earlier when I can, deal with things a little more in a planned fashion, I guess?
Right. We would prefer that you do call us in advance of that. If you're sensing change or just want preliminary information, folks have a lot more options. We always have options. Our agency is all about bringing options with an S, and you will have more options if you start earlier. There's an adage called, the 40-70 rule. If you're 40 and your parents are 70, you need to be having these conversations right now. But also, and largely folks, as they age, are afraid of losing independence. They're afraid of losing their power. And I would suggest that planning is power. You will have more options. You will be able to remain more independent and on top of things, and you yourself will have more flexibility and be able to be nimble as things change.
That's important, but you know what? That's a difficult conversation to have sometimes. But it is so important, and as you said, there are more options earlier in the game than when things do reach that crisis point.
Yes.
Well, Nancy, how do folks find out more about professional advocacy, and how do they find you specifically?
Well, I will begin with two professional organizations, APHA and one called NAHAC, NAHAC. Those national organizations, if one were to do a search of advocacy, those will both pop up. We have national directories that help people find us by need and zip code. I maintain a strong web presence because I'm working with people from all over the country whose families are here, so they need to be able to easily locate me. But we're fierce about our networking. If we're worth our salt, you will find us teaching, talking, networking, presenting to groups, working with other professionals. We've got to have a face in the community so that people can find us when there is a need. Excellent,
excellent. So they can find you directly or through national organizations.
Yes.
You're there as well. Great. Well, we've covered a lot of ground today, and I want to just see if we need to circle back. Is there anything we haven't touched on that folks do need to know about Navigate NC before we leave them today?
I would say that if folks are feeling a tug, if they're experiencing any kind of question about what may be going on, or that feeling that do I know all that I need to know, call us. We offer a free initial consultation, and we do offer evening hours for that because people are in different time zones, or they may need to talk outside of their work hours. Right. So if there's a tug, address it. Call us. We're happy to have a conversation, and we would encourage you to have a conversation.
Great. Well, what a wonderful resource. Nancy, thank you for joining us today. We're so glad to have had Nancy on our show today. There will be information at the end of this video about how to get in touch with Nancy. And also on our webpage, there'll be information about how to get in touch with Navigate NC to find out more. The conversation initially is a free consultation, and that's wonderful because there's so many questions about how to navigate that daunting process. So get in contact with Nancy and find out more. Thanks for joining us on RTP Business Live. We'll see you again real soon.